見えます。
OK です。
はい。
OK です。
はい。
見えます。
はい。じゃあ今日は僕の単元で2回目です。Principle of Guided Bone Regeneration の2回目になります。Development of the GBR technique. GBR as a clinical technique in conjunction with dental implants. Prosthodontically driven implant placement can result in peri-implant bone defects. Reconstruction of the bone ensures that the implant body is completely covered by hard tissue, avoids exposure of implant surface to oral environment, ensures that buccal linear bone walls are 1.5 mm thick, 2 mm in aesthetic areas. GBR allows clinicians to successfully place implant in the resolved alveolar bone. Clinical studies demonstrated the application of GBR bone regeneration around dental implants. こんな感じのですね。The 6 months of healing. Barrier membrane materials, biocompatible and well tolerated. There's two types, inert and non-resorbable. Resorbable breakdown products are released, increasing risk of tissue reactions. Cell occlusive. Some permeability is beneficial for nutrient transfer across membrane, allow tissue integration of stability of wound, stiffness and space maintenance properties, easy clinical handling. Non-resolvable membranes, EPTFE, tend to collapse, difficult to handle clinically. Hydrophobic membrane is not easily adaptable to defects. A distance of 1.5 mm from adjacent teeth must be maintained. Susceptible to soft tissue dehiscence and membrane exposure. Complement bone regeneration with membrane exposure. Second surgery required for membrane removal. Non-resolvable membrane EPTFE, high-density PTFE, titanium reinforced PTFE, non-resolvable membrane are no longer widely used. もう使われてないということですね。次はresolvable membranes, polymeric membranes, polyglycolides, polylactides were copolymers of PGA and PLA, biodegraded, biodegraded by a Krebs cycle. Degradation results in soft tissue inflammatory response. Collagen membranes, type 1 collagen, or a combination of type 1 and 3 collagen, biodegrade via enzymatic activity, may be cross-linked to increase stiffness and prolong degradation time. Cross-linked membranes may contain cytotoxic residue. Advantages: less susceptible to complication, easier clinical handling, no removal required. Disadvantages: non-cross-linked membranes collapsed easily, creating a maintenance space. Bone graft and or bone substitute and the barrier membranes. Autologous bone grafts are rapidly integrated, but tend to resolve and lose volume. Bone fillers, bone substitute with low substitution rates are better maintaining bone volume. Currently, there is no ideal bone grafting material. Most common composite graft of autogenous bone and bone filler with low substitution rate retain the osteogenic potential of autogenous bone. Benefit from the lower substitution rate of bone filler for value maintenance. titanium reinforced PTFE membranes, tenting screws, titanium mesh, titanium reinforced PTFE、タイタニアムメッシュ。これがテンティングスクリューズ。上浦先生、上浦先生、テンティングスクリューって知ってます？あ、声聞こえません。先生、声聞こえません。上浦先生、声が聞こえません。
これで聞こえるでしょ？
あ、聞こえま
ね。
す。
いや、
先生、これ知ってます？
もちろん知ってるけど、使ったことはないですよ、僕ね。一回ぐらいあった
そうですね。
かな。
僕も初めて見ました。
うん。いや、これでも結構使ってる人は使ってるんですよね。
そうなの。
あれ、ドクターバナージ、do you use tenting screw in Brazil?
Yes,
More yes. ね。
I used this titanium reinforced
うん。
mesh by Gore-Tex in the 90s. So now we have other companies, but became very, very expensive and
expensive. うん。
あ、
expensive. But titanium mesh for the posterior area, I have one case of ink success, so I don't use anymore because a different kind of mucosa. So the best use of pure titanium mesh is for anterior areas because you have a modulate. It's not we cannot say easily, but favorable
う
in
ん。
the anterior area than posterior area because the extension of the mucosa by the muscles of posterior area so can cause more dehiscence than anterior area. So I avoid in the maximum to use in posterior area. However, now I use maxillofacial plates and to establish the difference, the residual part. So in the middle, I used biomaterial and the cover with PTFE. So we have a more successful in the posterior area gain with mini plates, titanium, to avoid the compression of the mucosa and the extension of the residual mucosa there.
あ、OK。
いうことです、みたいですね。はい。
うん。Key learning points. PTFE membranes have lost their dominance because of problematic handling, soft tissue dehiscence, and the need for membrane removal. Resorbable membranes are most prevalent in clinical practice, particularly those made from collagen. Membrane support is predominantly provided by grafting materials, either autogenous bone substitute or a combination of the two. Simplified GBR technique. No need for membrane fixation. Bone graft and/or bone substitute supports the membrane. Lower risk of premature membrane exposure with predictable soft tissue healing. Fewer surgical intervention. ということで、と次はアセスメントいきます。順番に、Dr. Lee, could you answer please?
Yes. Barrier membrane materials for GBR should be self-occlusive but permeable to facilitate nutrient transfer, biocompatible, space reducing, easy to handle, impermeable. 1 to 4
1 to 4.
かな。あ、
Great.
おー、
Great.
great。
1 to 4.
すごい。
はい。
エクセレント。
Dr. Barnett, could you answer, please?
Polymeric membranes biodegrade via enzymatic action. Sun, the Krebs cycle, producing
Yeah.
carbon dioxide and water.
Great. Yes.
Thank you. I look forward to coming back to Singapore. Take care. See you. Bye.
上村先生、次お願いしま
はい。
す。
猫ちゃんと一緒に答えます。Isobubble membranes used for bilateral bone regeneration must be removed by the second surgical procedure. US colleges in the medical. True.
Yes.
True. にゃんにゃん
トゥルミヤミ。
にゃんにゃん。True ですかはい。ね。True です。
いや、これ、あれ、ナッツルだよ。これだって、
あ、本ですか
90、
あ、
これ
90世か。
90だからうん。
あ、ごめん。
そうです。うん。猫が間違っちゃった。
猫が間違った。私は合ってたけど、猫が間違えました。
はい、4番目です。Jennifer, could you answer,
いて
please?
てて、いてた。
The degradation rate of collagen membranes may be prolongated by curls linking the material with lateral data. Cross-linking, yeah. I think true.
True. Yeah. Okay. Yes. Yes. じゃあ、次また。Dr. Lee, could you answer, please?
Collagen membranes are made from type 1 collagen, a combination of type 1 and type 3 collagen, 1
Yeah.
and 2.
Yes. Great. じゃあ、Dr. Barnett, could you answer, please?
Resorbable membranes may be made of ET collagen, check. Polyglycolide, check. Polylactide,
Yes.
check.
Yes, except polytetrafluoro. Yes. Okay. じゃあ、上浦先生、お願いします。
The main disadvantage of polymeric membrane is that biodegradation is associated with presence of. これアンサーか。
そうなんですよ。これちょっと難しいですね。
高分子の主な欠点は。
うん。
高分子材料。
そうなんで、消去法で考えるとなんとなく。
細胞。3番目
いや、これね、実はね、俺もよくわからなかったんだけど、これ見て、巨細胞っていう。
巨細胞なんだ。
うん
なるほど。
もうよくわかんなかったです。
It's like osteoclast, multinucleated giant cell.
オステオクラストか。
Osteoclast, no, my precursor for osteoclast. Osteoclast になれるの。So,
Thank you. Thank you for.
そう。
じゃあ、Dr. Jennifer, could you answer, please?
Yeah. High density PTFA membranes and titanium reinforced PTFA membranes must be removed by a second surgical procedure. True.
Yeah.
True.
Yes, easy question.
Yes.
easy. はい、9番目です。じゃあ、Dr. Lee, could you answer, please?
The material in collagen membranes is derived from animal sources, mainly bovine or porcine material. True.
Yes. 牛と豚が作られています。Yes. そしたら、次は、Dr. Barnett, could you answer, please?
Non-resorbable membranes, such an expanded polytetrafluoroethylene (EPTFE), are easily adapted to the bone around defect. Not checked. Are difficult to handle clinically? Checked. Are associated with a high incidence of wound dehiscence and premature membrane exposure? Check.
Yeah.
Lack rigidity? Yes.
Yeah.
Check. Do not need removal before implant place, not checked. So, Ni San Yon.
Yeah. Oh, great. 2、3、4。
おー、すごい。
Not she. No.
Great. いや、これが多分最後ですね。ドクター、神谷先生、これ最後です。お願いし
The
ます。
advantage of collagen membranes are answered. No
Answered.
removal required. Less
うん。
susceptible to basement 特性。124かな。
そう、これだけ間違ってますよね。スペース作りがないからね。1、2、4です。はい、合ってます。
猫ちゃん、乗ってました。ね。
にゃー。
いやー。猫ちゃん。あれ、今日、あれですか、来週もできますか？
うん、来週で僕終わりなんで。
あ、わかりました。じゃあまた来週も。じゃあ。
Wait. I have question.
何？どうぞ。
Question.
Please.
Do you know open barrier membrane
yes. ドクター船越。ドクター船越。
open barrier membrane technique, sir.
ドクター船越？オープンメンブレイン。
船越の山下ね。
ね。
私もやってますよ、オープンメンバーの少しね。なんか、どっちもいけるんですかね。星先生、非吸収性膜で使うことあります最近。
いつも使って、あれ、本当にスーチャリングいらないでしょ。
使ってるんですか？そうなんだ。いろいろ考え方あるんだね。
オープンメンブレインって、オープンメンブレインはあれですよね。現状切開しないでそのままってことですよね。
そうです。
現状切開をすると、浮腫が起こったり、出血があったりするので、そのまんまで。
そう。
いろいろあるのね。
バヌッチ先生とか知ってるかな、オープンメンブレインのこと。
I asked, Vaneshi sensei, are you aware of open barrier membrane technique?
Yes, it's open. So open wound. Are you referring to open wound or?
Yes, open wound. So you use the D high density PTFE?
Yes, sometimes. For example, last week I made this one case. I removed the tooth because have a communication of a broken upper wall with the sinus. So we have communication. Yes. So we have a sinusitis become from a root canal and fracture. So we remove the teeth. I put in curettage. So I put in 3 blocks of PTFE. Sorry. LPRF. Small parts of PRF inside. So use the coagulus and put this PTFE, pure PTFE. So this is not a membrane. It's works like a barrier. So nothing is gonna in and nothing is gonna out. The difficulty is you must
no primary closure. No primary closure.
So you must extend more your wound and delocate it from the bone and use inside. Yes. Yes. And the suture is very, very difficult. So four hands is the best situation. Use from the central part suture first to stabilize the position of the barrier first, and after start from the
Mesial,
distal or
distal.
the mesial parts. So I spend more time to suturing because the suture, in my opinion, is the signature of your surgery. So,
Yes. Oh,
so
do
I have a
you
case.
know? Do you know who is the first person to describe the open barrier membrane technique? He's a Japanese.
Oh.
So his name is Funakoshi, A.G. Funakoshi, like Dr. A.G. Funakoshi. So he is currently 78 years old.
Yeah.
And he is still working. And he
Wow.
wants to retire at 88. I got his book and his signature.
I have here in as a Professor Kinoshita. I studied this in university, periodontics of Professor Kinoshita, Shiro Kinoshita. So I love books.
すごい。ね。そう、そう。
Dr. Jennifer, do you use open barrier membrane technique in Peru?
Yeah, we used to for preserving, as Dr. Banushi say, I never use for
GBR.
Yeah, for sinus communication, but I used to preserving the alveolum.
So the socket preservation. You do it for socket preservation.
Yeah.
After extraction.
Yeah, after.
Yeah. So it's the GBR that is done by Funakoshi Sensei using this open barrier membrane technique.
Yeah.
He managed to gain vertical and horizontal width a lot, and his book showed 20 years above outcome. It's very amazing. So yeah, it's very amazing. Like I can't believe it. And you get the beauty of it is that you won't move the mucogingival junction because you let the open wound, right? Secondary closure. So if you do primary closure, you're going to move the mucogingival junction up. So your sulcus is going to be like narrower. And then also a lot of keratinized tissue for GBR. So you don't have to do FGG later. So you don't have to do the soft tissue surgery after. So I think he's genius. I think he's genius, really.
It's interesting because sometimes we tend to put a lot of things inside. So your body must work with many things: implants, biomaterial, resorbable membrane. So for the same material, you have different ages. And for me, osteometabolic time is different from the person with 70s and 80s. Is more different. And for the young, for example, if a young lost a fracture of impact, for example, is more rapidly the metabolism compared with for the same material. You can have used the best material, but for old people is less.
Longer time.
Sometimes less is more. I have interesting cases. If it's possible, we can show in 10 minutes or next week or we prepare a short presentation with this case of open wound.
Oh, that would be
で、
interesting.
あれですね、星先生、今度ね、next time we have a discussion about open and closed technique やね。
Yes, I think it's very interesting.
Open versus closed ね。
Yes,
international meeting ね、from near future ね。で、今度やりますかね。オープンね。僕もオープンもクローズも両方やってますけど。ね、まあ、両方いいけど、ちょっと山越さんに、船越さんに聞いてみますね、今回。あったら。ね、はい。じゃあまた来週じゃあよろしくお願いします。
僕は用意はしときますんで。
はい、すいません。 まだ、
いやいや。
インターナルシンポジウムは、その後でやりますから、また。
うん。
はい。すいません。はい。それでは、
札幌に行きたい。
I talk to about Professor Fenokoshi next time.
Oh,
ジューンかな
okay.
うん。お願いしますからね。はい、大丈夫です。
Oh,
はい、お願いします。はい。
ah,
はい。お願いし
yeah,
ます。は
okay.
い。バイ
Bye-bye.
バイ。
See you
ま
next
た
week.
ね。また来週。
Yeah.
Thank
また来
you. Have a
週。
nice week.
Bye.
Thank you.
Have a nice week, everyone.